Mình sẽ gọi trực tiếp thỉnh tới rồi nha. Những bạn nào có mình được gọi tên thì hy vọng là bạn có thể mở camera, nếu không có mở camera thì có thể mở mic lên để mình có thể discuss. Okay, so bây giờ mình nói tiếng Anh nha. So today I'm gonna talk about the heart failure. So for this part, we're gonna talk about three different parts. The first part today lasts for 1 hour, talking about the definition and the pathogenesis of the disease. And for the second part, probably we're going to talk about the diagnosis. And for the last part, we're going to talk about the treatment. So for the first part, the first thing we're going to talk about is evidence-based medicine. And for the second, after that, we're going to talk about the definition of the heart failure. After that, we're going to talk about the classification, pathophysiology, clinical presentations, prognosis, and diagnostic approach. And for the next one, we're going to talk about the treatment. Okay, so the first question is about the evidence-based medicine. So as you can see from here, especially when we talk about some treatment for heart failure, we're going to talk about using about different guidelines. So this one is taken from the guidelines from the ACC or AHA that released like a few days ago on April 3rd about treatment for heart failure. So when you read a guideline, you're going to see that one. You're going to see that class of recommendation is 1, 2A, 2B, or 3, and you're going to see about the level of evidence is A, B, C. So now I'm going to pick a first person. Okay, let's see. So first talk. Nguyễn Thị Cẩm, this one. Can you unmute, please? Nguyễn Thị Cẩm Duyên. Can you unmute, please? Where is she? Okay. Trần Văn Trung à? Bạn có thể mở mic, có thể nói chuyện với mình được không ạ? Trần Văn Trung à?
Dạ có em anh ơi.
Hello bạn à. Theo bạn thì hồi giờ bạn có đọc cái line như thế này chưa, và bạn có hiểu ý nghĩa là class of recommendation 1 và level of evidence là cách như thế nào, và có khi bạn đọc như thế này thì nó có nghĩa như thế nào không ạ?
Dạ anh ơi, vốn tiếng Anh của em hạn hẹp nên em không có hiểu cho lắm à.
Khi mà bạn nhìn một cái guideline như thế này đó, thường khi mà bạn xem một cái guideline, một cái heart failure hay là một cái suy tim gì đó, thì bạn sẽ viết dạng như thế này là có một cái guideline, là có một cái thứ nhất là class of recommendation là bên cột bên trái, và level of evidence là cột bên phải. Thì bạn có hiểu là cái này là có ý nghĩa như thế nào không? Giả sử như cái này là cái 1A thì nó như thế nào, cái này là 2A, BR thì như thế nào? Trần Văn Trung đâu ạ?
Dạ theo em nghĩ là cái số 1A là có
Hồi
một
giờ bạn đã
bệnh
nghe
nhân.
về này chưa?
Dạ có rồi ạ. Là ở một bệnh nhân gì mà bị khó thở do một
thường
cái
á,
dạ.
mà mình không có cần bạn dịch, mà mình đang hỏi bạn á là cái CRR là class of recommendations và cái LOE là level of evidence. Thì cái số 1 hiện nay có nghĩa là gì? Bạn đã chữ A có nghĩa là gì?
Dạ theo em số 1 là cái lời khuyến nghị, còn cái lot là mức độ ạ.
Sorry, xin lỗi mọi người nha, có vấn đề kẹt một xíu. Nãy mình Trung nói gì, mình nói Trung nói lại được không mà? Dạ mình không nghe rõ à? Anyway, mình có thể nói về khi mà so when you see so when you see that the class of recommendation is 1 or 2A or 2B or 3 or something like that, or also the level of evidence is A, B, or BR, BN, level C, something like that, it has different meaning. So it is the way that the guideline talk about what should you do and what you should not do. So for example, here, class 1 means that it is recommended, it is indicated. For class, it's very strong recommend. It is strong of recommendation because it COL means that the class of recommendations. So level 1 means very strongly recommended. Class 2A it means moderately recommended, and 2B means weak, and class 3 means non-benefit or in generally when it have that. So when you see that class 1 is when the benefits is much lighter than risk. For class 2A, benefit is somewhat also largely more than risk. For class 2B, the benefit is more than or equal to risk. For class 3, equal, and for class 3 harms, it is strongly not recommended. It means that the risk is higher than the benefits. So whenever you see that the class recommendation is 1, it means that you should follow that advice, you should follow that guideline. On the other hand, when you see that something say here, like for example, they had the red color or harm, class 3 harm, in that case, you should not follow the recommendation. It means that you should not doing that. So at the same time, when you see everything, you're gonna see that one column is about the class recommendation. On the other columns, you're gonna talk about the level of evidence. So the level of evidence, it means that we have different level of evidence. Level A, BR, BNR, level C. So level A means that the result, the recommendation is taken from, it can taken is a result of multiple randomized clinical trial. It's more than one clinical trial, or it's from one meta-analysis. So any one of you can tell me what the difference between the randomized clinical trial and the meta-analysis? Let me pick one person. Can you tell Nguyễn Thành Danh? Can you unmute, please? Nguyễn Thành Danh. I can see on my screen Nguyễn Thành Danh 1849402.
Yeah. Hi, Eman.
Okay, bạn. So can you tell me what the difference between the randomized clinical trial and meta-analysis? Okay, so mình gợi ý là hồi trước giờ bạn có biết là cái tab mà nghiên cứu không? Là những cái ở dưới cùng á, là những cái mà có low evidence, nó không có have a lot of risk bias. Ở cái ở trên đỉnh á, là cái mà thường có level evidence rất là cao. Chờ một xíu. Okay. Wait. Okay, so hồi giờ bạn đã nhìn thấy cái này chưa? Nguyễn Thành Danh.
Dạ chưa anh.
Okay, so usually okay, để mình giải thích nha. Thường á, khi mà làm về nghiên cứu khoa học á, thì những cái mình muốn mà những cái mà có giá trị á, là randomized control or randomized clinical trial.
và những cái trên đỉnh này là cái mà có giá trị nhất, đó là meta-analysis. Thì cái randomized clinical trial có nghĩa là thường á, là những người làm nghiên cứu là bệnh nhân sẽ được phân chia làm hai nhánh. Nhánh thứ nhất là nhánh được chữa trị, và nhánh thứ hai là nhánh placebo, là nhánh không nhận chữa trị. Thì randomized control trial là bệnh nhân sẽ được chia vào ngẫu nhiên hai nhánh, và cái người thực làm nghiên cứu và cũng như bệnh nhân đều không biết bệnh nhân là làm cái gì. Cái đó gọi là double blinded randomized clinical trial. Và cái này là ở mức ở giữa, hay là mức coi như là mức được của trong khi làm nghiên cứu. Còn mức trên đỉnh gọi là mức meta-analysis. Meta-analysis là cái nghiên cứu mà mình tổng hợp lại một số về một số randomized clinical trial, hoặc là những cái dưới này mình tổng hợp kết quả của những cái dưới mà mình đưa ra kết quả cho cái meta-analysis gọi là. So meta-analysis is a research study that combine meta-analyze the result from the multiple randomized clinical trial or the other different type study. We have result that collected all from other studies. So in that case, meta-analysis show a strong level of evidence. So also, vì thế mình bạn có thể nhìn thấy chỗ này là cái level A là hoặc là more than one randomized control trials or from a single meta-analysis. Cái level, vì thế nên khi mà bạn nhìn thấy cái level A á, có nghĩa là cái này là cái mà được đưa ra được is a result of the multiple randomized clinical trial or meta-analysis. Level B is usually from one randomized clinical control trial or the meta-analysis, but not from a high quality. And the level C is usually a consensus expert opinion beyond the clinical experiences. Vì thế nên mà khi bạn nhìn thấy những cái nào mà class of recommendation 1A thì cái đó là strongly recommended. Những cái nào mà giả sử như là ví dụ như thế này là so in this case it is not recommended for to perform this thing for the patients. Okay. So from now on, whenever you read any guideline or any equal evidence-based medicine, so whenever you read any guideline from ACC about the management of the heart failure, you know that what you should do and what you should not do. Okay. So now another question. So what is the difference between the syndrome versus disease or disorder? Can one of you gonna tell me about that? Let me pick one person. Okay. Okay, so this one you can learn it from the first or second year, so I think that everyone should know that. So for example, in this case, can I pick a person from the second year, for example, Trang Hongman? Can you talk about can you unmute please? Trang Hongman.
Yeah.
Can you talk about what are the differences between clinical syndrome and a disease or disorder? So clinical syndrome means hội chứng, disease means bệnh. So what is the difference between the clinical syndrome and the disease?
Dạ thưa thầy là hội chứng lâm sàng, hội chứng rối loạn lâm sàng.
No, so can you tell me the difference between why we sometimes we call it a syndrome, when we're gonna call it a disease, and when we're gonna call it a syndrome? And the second question for that is that what is a heart failure? Is it a syndrome or is it a disease?
Mình so sánh cái bệnh
Okay, there's someone right hand. Nguyễn Thành Danh, can you open your mic, please? And if you know something, can talk about that. Okay.
Excuse me.
Yes.
Would you mind if I answer your question?
Yes. Go ahead.
Well, as far as I know, disorder is an illness that disrupts normal physical or mental functions. And while in contrast, syndrome is a group of signs and symptoms that occur together.
Okay, correct. Excellent. And so, as Thành Danh, right, already talked about, so clinical syndrome is a collection of the, let me see, sorry. So clinical syndrome is a collection of the clinical finding. It can be the sign and the symptoms that these signs and symptoms may caused by specific cause or cannot relate to each other, and it not always have definite causes. While disease, it has a definite, a specific cause. It have a distinguishing symptoms, and it has a specific treatment and pathophysiology for that. So, Thành Danh, can you tell me that because the lecture today going to talk about the heart failure? According to you, what is the heart failure? Is it a syndrome or is it a disease? Yes. So according to you, a heart failure is a syndrome or is it a disease? Recording in progress. Okay, so you don't know, I can tell you about that. So according to the ACC 2023 and also the 2021 from the European Society of Cardio guideline, we're going to talk about that heart failure is a clinical syndrome. As you can see from here. So heart failure is a clinical syndrome that combines of the symptom and sign that impact that result from the structural and the functional impairment of the ventricular filling or ejection of blood. Because the collective symptom, it can be with dyspnea and fatigue. Okay. Also, it is the same thing from the 2021 European Society guideline. It's gonna say that it's also a clinical syndrome. It combines the sign and symptom. The symptom, for example, can due to like swelling or fatigue. For the sign, I'm gonna talk about like, for example, elevated truncular venous pressure or crackle, something like that. So now, can one of you tell me what the difference between the symptom and signs, please? Anyone know can raise their hand or I can call another person. So what the difference between the symptoms and signs? Okay, so this one also very easy, like for the second year also. Thank you, me. Can you answer the question, please? Can you see on the screen? Thank you, me. Here. Thank you, me. Okay, so next person. Ông Thị Diễm Quỳnh. Can you unmute, please? Okay, anyone of you can open the mic and know the answer. What difference between the sign and symptom? Sign thì nghĩa gì ạ? Triệu chứng. Symptom là gì? So, Sơn Quỳnh Như, Hey, did anyone of you can know the question? Is one person raise their hand here? So what is right? The Hồng Gum, can you tell me please what is the difference between signs and symptoms?
I think the symptom is the problem which patient reports to the doctor, and
Okay.
and the sign
Correct.
what the doctor find on the examining the patient.
Okay, excellent. It's correct. So yeah, exactly. As like Đạo Hồng Gum say, a symptom is from over here. The patient complaining about ankle swelling, fatigue. What is I gonna talk about today? Some like record when we listen to a patient lung or the peripheral edema. Okay, so the next thing we're gonna talk about is the classification of the heart failure. So this one is classification from the European Society of Cardio. When we define the heart failure, we can have three categories. The first thing is the patient with the reduced heart ejection fraction and with preserved ejection fraction, and the patient with the symptom or with the sign between the reduced and preserved. In this case, we're gonna call it mid-range. So firstly, as you can see from here, it is a reduced ejection fraction. When we had a sign and symptom, as well as we have the left ventricular ejection fraction less than 40%. So for the sign symptom, we can see that for the, you can see it from here. The symptom is the sign, okay? And for the preserved ejection fraction, we can have that patient can have ejection fraction more than 50%. So for the heart failure with the mid-range ejection fraction, the ejection fraction usually from between 41 to 49%. And so here is this one is from the 2021 European Society of Cardio, and this one is from the ACC, the American College of the Cardiologists. So this one is from this year, just released about a few days ago. And more lately talking about the same thing. It also having like the reduced ejection fraction with the ejection fraction less than 40%, or they can preserve ejection fraction when they have more than 50%. However, here they also for this ACC 2022, they're talking about for the mid-range, they're going to divide into two different categories. The first one they're going to talk about the improve the ejection fraction, and the second one is talking about the mildly reduced ejection fraction, or in this case for the 2021 it's called mid-range, but for the ACC, we're going to talk about the mildly reduced. So what is the difference between the improved ejection fraction and the mildly reduced? For the improved, they talk about it previously, it's lower than previously, it's less than 40%, so it's within the reduced ejection fraction. However, for follow-up measurement at the moment, it's more than 40%. In that case, we're gonna call it improved ejection fraction. For the mid-range mildly reduced, it's only within the 41 to 49%. So this one is the new definition of the ACC or AHA from 2022. Okay, so we also had different terminology talking about when you're talking about heart failure. We're gonna have a right heart failure, left heart failure, biventricular heart failure, or global heart failure, chronic compensated heart failure, or acute decompensated heart failure. We also can have the systolic heart failure or diastolic heart failure. So now, can any one of you talk about what the difference between the right heart failure and left heart failure and biventricular heart failure? So I'm gonna call one of you to talk about that, okay? Any one of you know the answer can raise their hands, otherwise I'm gonna ask one person also. Hồ Đăng Đạt, can you unmute and can you let me know what the difference between the right heart failure, left heart failure, or biventricular heart failure, please? Hồ Đăng Đạt 190 6898.
Dạ.
Can you talk about what difference between the right heart failure, left heart failure, and biventricular heart failure? You can see from here, you can see that.
Nhờ thầy hỏi tiếng gì tại em nghe tiếng Anh không rành lắm.
Okay. Right heart failure mean suy tim phải, left heart failure mean suy tim có nghĩa là suy tim trái, và biventricular heart failure có nghĩa là suy tim toàn bộ. Thì ba cái đó có nghĩa khác nhau như thế nào?
Dạ thưa thầy là suy tim trái thì sẽ khó thở kịch phát về đêm, còn suy tim trái thì kịch phát về đêm với lại là tăng áp lực của mạch phổi, bên cạnh đó là có sự tắc nghẽn của phổi, có thể là ho, tiếng rắt, khó thở, và khi ho thì ho có đờm. Còn nó sẽ
cái đó là bạn nói đúng về cái triệu chứng, nhưng mà mình muốn là về cái pathology, bạn có thể nói về cái pathology của cái bệnh được không? Xin lỗi, bệnh được không? Ví dụ là suy tim phải là cái gì và như thế nào, ví dụ thế. Thì tim mình là có tâm so for the heart we're gonna have like the right heart gonna have the right atrium, right ventricle. For the left heart we're gonna have left atrium and left ventricle. So what happened when you had the right heart failure? What gonna happen when you had a left heart failure, something like that? So okay, so okay, I'm gonna một bạn nào có thể trả lời được? Có thể dưới đây được không ạ? Không, mình gọi nữa nha. Ok, Quang Ái Nguyễn Phú, bạn có thể unmute được không? Bạn có thể mở cái mic, có thể nói về được không?
Dạ, anh có thể nhắc lại câu hỏi được không ạ?
Suy tim phải, suy tim trái và suy tim cục bộ, suy tim toàn bộ thì có khác như thế nào?
Dạ, suy tim phải, suy tim trái và suy tim toàn bộ.
Cái này là suy tim phải này, cái này suy tim trái. Thì bạn có thể thấy được chứng lên này. Để thấy chứ, bên này bạn có thấy là bị phù chân này, phù tay này, hypertrophy cái gì?
Suy tim phải thì sẽ ức trệ cái tuần hoàn từ lên tĩnh mạch, gan, chân thì nó sẽ gây phù. Còn suy tim trái thì sẽ bị yếu đi cái phần tĩnh mạch phổi và cung lượng tim.
Ok. Nguyễn Thành Danh do đây, bạn có ý thêm không ạ? Nguyễn Thành Danh.
Dạ, anh hỏi là về suy tim phải là cái nhắc tới là cái định nghĩa của suy tim phải không ạ?
Đúng rồi.
Suy tim phải là khi tâm nhĩ và tâm thất.
Yeah, in English because I do not know Vietnamese.
Right cell fuller ion when the right atrium and right ventricle.
Bạn nói Việt cũng được.
Dạ. Để em nói tiếng Việt đi anh ơi, em nói tiếng Anh em nó không rành cho lắm anh ơi. Nếu nói về suy tim phải là mình sẽ suy tim ở tâm nhĩ và tâm thất. Suy giảm cái chức năng co bóp mà gây cản trở lưu thông máu từ tâm thất phải lên phổi. Nó gây hậu quả là ứ động máu tại các hệ tĩnh mạch nên là gây phù.
Đúng rồi.
Triệu chứng của nó thường xuất hiện trong các mô của cơ thể. Thời gian dài á, thì có thể gây ra là phù, gây ra là phì đại tâm thất phải, làm giảm cái khả năng bơm máu ở tại các cơ quan.
Đúng rồi. Còn suy tim trái thì như thế nào ạ?
Về suy tim trái á, thì
Mình bạn có thể nhìn thấy hình này có những triệu chứng bạn có thể từ đó mà suy ra được. Suy tim trái có nhiệm vụ là gì? Chống máu ra chống máu ra các cơ quan cả cơ thể. Còn tim phải là để nhận máu về, đúng không?
Yeah.
Thì khi mà suy tim trái á, thì we can talk in English. So for the left heart failure, you're gonna have left ventricular dysfunction that gonna result in the tissue hyperperfusion. So when you had a left heart failure, you're gonna have like failure to pumping blood. So in that case, you're gonna have like the tissue hyperperfusion. At the same time, you're gonna have backward failure. In that case, you're gonna have like the increase of the pulmonary capillary pressure. In that case, you're gonna have the pulmonary congestions. So for the backward failure, you're gonna have the pulmonary congestion. For the forward failure, you're gonna have like, for example, when you had less blood go to the brain, you're gonna have like confusion. When you had less blood go to, for example, to the heart, you're gonna have slight chest pain or tachycardia. When you had the less blood going to the kidney, you're gonna have renal failure or something like that. So in that case, you're gonna have left side heart failure. Okay. So the next question is that can you tell me the difference between the chronic compensating heart failure and acute decompensating heart failure? Nguyễn Thành Danh, if you want to continue the discussion, you can tell me what the difference between a chronic compensating heart failure and acute decompensating heart failure.
Dạ, em cũng không em không hiểu câu hỏi cho lắm, anh có thể hỏi bằng tiếng Việt được không anh?
Cái sự khác nhau giữa hai thuật ngữ là chronic compensating heart failure. Chronic nghĩa là bệnh mãn, acute nghĩa là cấp tính, compensated có nghĩa là cái này nghĩa là suy tim cấp tính mất bù, còn cái này có nghĩa là suy tim mãn tính bù. Thì cái này nghĩa khác nhau là gì?
Dạ, cái em nghĩ là khác nhau là suy tim mạn đó là tình trạng thời gian suy tim kéo dài qua kéo dài qua rất lâu rồi, làm cho chức năng tim bị giảm, nên làm cho chức năng tim bị giảm, khả năng co bóp của tim nó giảm. Còn cấp tính đó là đột ngột khởi phát, khởi phát trong kéo dài vài ngày.
Ok. Đôi lúc em vẫn nghe là acute on chronic thì nó khác nhau với cái gì với acute? So sometimes we're gonna heard about chronic heart failure. Sometimes we're gonna heard about the acute heart failure. Sometimes we're gonna heard acute on chronic heart failure. So what is the difference between those? Okay, let me talk about that. Okay, so chronic compensating heart failure is when a patient had the signs of the chronic heart failure, which means that we already talked before when he had the signs, symptoms like fatigue, pulmonary congestion, something like that. However, at that time, currently, patient is asymptomatic, or maybe they had a symptom that is stable. For the other case, we had the acute decompensating heart failure. That means that it can have two scenarios. The first scenario is exceedingly deterioration of the chronic condition of heart failure. or it also can be the new onset of a severe heart failure. It is due, for example, acute cardiac condition, like for example, patient develop a MI or myocardial infarction, and they develop acute compensated heart failure. So to summarize, acute decompensated heart failure, they have two scenarios. It can form the suddenly deterioration of the chronic heart failure, or it can develop a de novo heart failure. Okay, so this one, the next question. Can one of you read the question, please? Let me, Trần Đức Duy, can you read the question, please? Trần Đức Duy, can you read the question, please? Okay, so any one of you want to read the question, raise their hands, please.
Could I volunteer?
Yes.
So question 1, a 65-year-old man comes to the physicians for evaluation for 2-month history of worsening fatigue and shortness of breath on exertion. He has a history of hypertension and begin prostatic hyperplasia. His medication include daily amlodipine and prazosin, but he reports having trouble adhering to this medication regimen. He used to be able to walk 4 to 5 blocks at a time, but now he reports he occasionally feels shortness of breath while walking across the room. He denies any symptoms at rest. He also reports waking up from having urinated at least once every night for past 5 months. Recently, he has started using 2 pillows to avoid waking up, coughing with acute shortness of breath at night. His pulse is 25 times per minute. Respirations are 20 per minute. And blood pressure is 145 per 90 mg/Hg. Physical examination shows 2 bloods bilateral beating edema of lower extremities. Auscultation shows an X4 gallop and 5 bibacillar rails. Which of the following is his diagnosis?
Sorry. Okay. So.
Sorry.
No, wait. So
I didn't have my breakfast, so I am a little bit shaking.
No. So thank you for reading the question. Your pronunciation is very good, really good. So just a few questions.
I very appreciate it. Thank you.
This one in minutes, this one in millimercury. When you read something, millimercury, this one in minutes. Okay. So this one is basic question to talk about is a classification of the heart failure. So when you talk about the heart failure, we can classify the heart failure in. So in this case, we're gonna. This is one of the highlight of the thing that you need to know about the questions, because in this case they're gonna talk about the diagnosis, like the stage or classification. So patient report that he occasionally feels shortness of breath while walking across the room, and he denies symptom at rest. So for this case, so I see from here, to classify the heart failure, we can have the New York Heart Association. In this case, going to have 4 classes. It's one from 2021 from European Society of Cardio. Again, class 1, if we have no limitation of the physical activities. For class 2, we can have slight limitation on the physical based on comfortable address. And for class 3, based on marked limitation of the physical activities and comfortable only as less, comfortable address, but less than ordinary activities. And class 4, we can patient unable to carry any physical activities. So this one is the one of the classification of heart failure. This one is from the New York Heart Association, also known as NYHA. The second classification of the heart failure is based on the AHA, which means we have different stage, stage A, stage B, stage C, and stage D. So for stage A, it means the patient at risk to develop a heart failure. For stage B, it means that the patient had a pre-heart failure. Stage C, it means that still mild heart failure. And stage D means that the patient had advanced heart failure. So also we have a table from the 2013 from the AHA and ACC guideline. Here you can see that they compare between, we're going to see that they have that for class 1 of the heart from the NYHA, what is the equivalent to the staging of the ACC. So I can see that the patient stage A means that patient at risk of the heart failure. So patient doesn't not yet have a heart failure yet. So in this case, you see that it is not corresponding to any class in the NYHA. For stage B, it is equivalent to stage 1, class 1. For class C, it is equivalent to class 1 to 4, and stage D means that's equivalent to the class 4. So go back to our questions. Patient complaining about the occasional feeling of shortness of breath while walking across the room and deny any symptom. So in this case, you're gonna see that the patient had a marked limitation of physical activities and comfortable address, but less than ordinary activities that result in different shortness of breath or fatigue palpitation. So in that case, you kind of see that patient feels shortness of breath while walking across the room. It is ordinary physical activities. However, patient deny any symptom and address, so it is not stage 4 yet. So in this case, we want to say about class 3. Okay, so I think we only have like 10 minutes left, so I would like to go to a very quick question about like the heart. Because it's gonna take too long, so I'm gonna talk about this one. Because in this case, we talk about the basing with the S4 guideline. So now I want to talk about how you perform a physical examination on a patient. So for this case, you want another person talk. Read this case, please. Lâm Chí Hồi, can you read the question, please? Lâm Chí Hồi, bạn có thể đặt câu hỏi được không? Ông Trần Thanh Nhã cũng được nè. Trần Thanh Nhã, bạn có thể mở mic và có thể đặt câu hỏi được không? Trần Thanh Nhã. Ok, Lê Thị Ngọc Như Ý, bạn có thể đặt câu hỏi được không ạ? Lê Thị Ngọc Như Ý. Có bạn nào muốn đặt câu hỏi không ạ? Các bạn nào đặt câu hỏi được không ạ? Bạn Danh hồi nãy có thể đặt câu hỏi được không ạ?
Dạ.
Ok. Bạn Danh có thể đặt đặt câu hỏi được không ạ?
CTC out men comes to the physical physician because of a previous history of shockness of breath with a session. He has his hypertension,
hyperlipidemia, and type 2 diabetes mellitus. The current okay.
hyperlipidemia and type 2.
Okay, so bạn có thể nói hypertension có nghĩa là gì không ạ? Hypertension có nghĩa là gì? Hypertension có nghĩa là cao huyết áp. Hyperlipidemia có nghĩa là
tăng lipid máu.
Đúng rồi. Và type 2 diabetes mellitus.
Tiểu đường tiếp 2.
Đúng rồi. Okay. The current medications include aspirin, losartan, and simvastatin and insulin. His temperature is 37.1, pulse is 74 per beat per minute, blood pressure 150 over 64 millimercury. The blood oximetry on the room and so oxygen saturation is 96%. The cardiac examination is so as follows. And the heart sound is best heard with the bell when the patient placed on the left lateral decubitus position at the cardiac apex. So now I'm gonna open the heart sound, and can any one of you answer this question, please? Can anyone of you hear? Mọi người có nghe âm thanh được không ạ?
Dạ chưa.
Okay. Mọi người có nghe không ạ? Okay, so can one of you can let me know? So firstly, can you tell me what is the condition patient have and what is the sound you can hear from here? Okay, can one of you answer the question, please?
Can I?
Yes.
Thank you. So I think I heard a murmur in the sound one, in the first sound, when the heart that is the close of ventricle and atrial. You know, I heard about bicubic and tricubic valve. Yeah, mercury in that, I think.
Actually, for this case, I'm gonna ask very quickly, like, what is the sound here? We're gonna have like the S3 and S4. Okay. Can remove S1? I eliminate 50%. Okay. You can hear it again.
Yeah, thank you.
So, what is the heart sound you can hear from here? Is it at S3 or S4? So, how can you difference between S3 and S4?
I think S4.
So actually, it is S3. So,
yeah.
So let me turn off the sound first. Okay.
Can you show me that? Yeah, I'm not really professional on this. I'm not really a professional on this.
No worry.
Can you teach me? Because I came to class late. I came to the class late, so
no worry.
Yeah.
So firstly, we need to so for this case, we do not need to know the patient history because it is basically a question about how a heart murmur. We listen to heart murmur, you know what is heart murmur, what is that? But before that, I would like to talk about what the condition patient have. Patient had a shortness of breath for 3 weeks on exertion, with the history of the cardiovascular risk factor for heart failure. And patient and at the same time, patient that heart can hear from here. It is S3 with the typical murmur in the heart failure. So in this case, patient is having heart failure. So here you can see that when you hear some heart cell gonna say that Kentucky came in S1. Turkey usually something that usually goes quickly together. Kentucky, you mean that S3. So in this case, gonna heard that Kentucky. Okay, so in this case, gonna be S3. on the honors for the others case for S4, you're gonna see that Tennessee. So in this case, it's gonna be S4. It is right before S1. For S3, it's right after S2. Okay. Can you see from here? Tennessee. Can you hear that? Can you hear that? Can you hear the sound?
The C sound a little bit small.
Okay,
yeah, but it's very nice.
Mm-hmm.
I love it. Thank you a lot.
Okay, no worries. You're welcome. So that's how you can difference between. So when you see the heart sound, okay, this was sorry, both sounds. So for Tennessee, we say F4. This is mnemonic for when I study medicine. People told me that when you study for UCLA, because we're gonna have that in my exam, so it's a mnemonic for you to remember how you differentiate between the F3 and F4. So so now you can know the difference. You can identify the F3 and F4. So can any one of you tell me in which scenario we can have F3, or in which scenario, in which condition we have S4, and what is different between why we have S3 and why we have S4? Okay, can I call one other person? This is the last question of the day, by the way. We finally make it. Tạ Trọng Nhân, can you unmute, please? Can you tell me what's different between F3 and F4? Okay, so I will talk very quick about the difference between F3 and F4, and we finished class today, okay? So for S3, we commonly see it in the, so we can see it in the normal, healthy individuals, or can also be through the pathological disease. So for the healthy, you can hear S3 in the young and athletes. In that case, or F3 is the sound due to the rapid ventricular filling or the sudden deceleration of the blood into the into the ventricle. So in this case, in the young healthy, we're gonna have like the heart, especially in the male, we're gonna have the heart wall is very thick in hypertrophy. So in that case, you're gonna heard about F3. Or some example like patient with heart failure, for example. For F4, it usually happen. You can hear that in the late diastolic phase, and late diastolic due to the contraction of the atrium against the high ventricular pressure. So in that case, you can hear in, for example, in the patient with the heart with the left ventricle hypertrophy, or patient with the ischemic cardiomyopathy, or in the patient with the MI. Okay, that's all for today, I think. Okay, do you have any other question for me or something like that, or otherwise we can conclude lesson today. I can tell so the take home message today is that, well, firstly, you know the definition of a heart. So firstly, you know how to read a guideline. You know that's what a class of recommendation, what is a level of evidence. So yeah, when you read something like, for example, here in the end, when we diagnose condition, we're gonna have like this one. We're gonna have like class 1A or level of evidence, or sometimes we're gonna have like, for example, class 3 and level of evidence exists. In this case, we should not do this one for patient. In this case, we should do this for patient, for example. So now you know how to read the guideline. You know from the guideline, you know what to do. And the second, you know that what is the difference between the clinical syndrome and disease. And heart failure is a clinical syndrome, and you know definition of the heart failure. After that, you know some definition about difference between like the right heart failure, left heart failure, or chronic compensated heart failure, or acute decompensated heart failure. After that, you know the classification of the heart failure, and some basic physical examination of the heart failure, especially about the heart murmur. Okay, that's all today. Thank you for your attention. Is there anyone having a question for me? I'm happy to answer. Otherwise, we can conclude the lecture today. I think that's all for today. Thank you a lot. See you next time, hopefully. Chào mọi người ạ.
Chào anh. Cảm ơn anh nhiều.
Em chào thầy, em chào anh.
Dạ, em xin cảm ơn anh Nhật, bác sĩ Nhật đã truyền đạt những kiến thức của mình về bệnh suy tim cũng như là về Anh văn chuyên ngành cho các bạn sinh viên ngày hôm nay. Và sau đây sẽ là thời gian để các bạn đặt câu hỏi dành cho bác sĩ Nhật. Thì không biết là nếu các bạn muốn đặt câu hỏi thì mình có thể bật mic để trò chuyện trực tiếp, hoặc là có thể nhắn tin vào khung chat. Và nếu như mà không có bạn nào muốn đặt câu hỏi dành cho diễn giả thì em xin cảm ơn anh Nhật. Và sau đây thì em xin mời các anh chị cho tụi em xin ý kiến về chương trình ngày hôm nay. Em có thấy tin nhắn trong khung chat đó anh.
So I study medicine in Italy, in Milan, Italy. And currently I'm working in research in cardiovascular in Mayo Clinic in Minnesota, and also, so for the Mayo Clinic, I work on the cardiovascular disease, and for mostly on the genetic condition. For also at the same time, I'm also working for Cedars-Sinai. I'm working for cardiac prevention and artificial intelligence.
Can you speak Italian? You said you study in Milan. Can you speak Italian?
Yes, I can speak Italian. So what you so because
yeah. Mấy nhá đèn cái điện nó không có lên, không có bật tựa.
Không, nhưng mà con bấm nó lên, nó ấy sáng không?
Nó sáng đèn.
Như vậy là cái ban nghĩ là cái, nhưng mà con bấm xong rồi con không có giữ luôn phải không?
Không.
Dạ, như vậy thì chương trình hành trang sinh viên y khoa DNC kỳ số 5 đến đây xin kết thúc. Và em xin cảm ơn quý thầy cô, quý anh chị, cảm ơn anh Nhật và các bạn sinh viên trường Đại học Nam Cần Thơ đã dành thời gian quý báu để tham dự chương trình ngày hôm nay ạ. Và sau đây thì em xin mời các bạn sinh viên của chúng ta cùng nhau mở camera để chào thầy cô để mình kết thúc chương trình ngày hôm nay mọi người. Và phòng Zoom của chúng ta sẽ tự động đóng lại sau 5 phút nữa. Và em xin hẹn gặp lại quý thầy cô và các bạn sinh viên ở chương trình hành trang sinh viên DNC kỳ tiếp theo ạ.
Bye bye mọi người. Dạ.
Chào Nhật nha Nhật.
Người nói nha.
Recording stopped.